Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive into a medical case that, at first glance, it doesn't make any sense. It's a total contradiction happening inside one person, and we're going to unravel exactly how something like this is even possible. So here's the big question, the paradox at the heart of this case. How can a person have severe constipation but also fecal incontinence at the exact same time? I mean, how can you not be able to go but also not be able to hold it in? It sounds like a riddle, right? But it's a real medical mystery. And the answer is all tangled up in our body's electrical wiring. Okay, so let's look at the case file. We've got a 31-year-old man who was in a car accident about 6 months ago. And ever since then, he's been dealing with this really strange bowel dysfunction. A checkup confirms two absolutely critical facts. First, his lower colon is just full of stool. So there's the constipation. And second, his anal sphincter tone is really weak, which is causing the incontinence. These are our two big clues.
So to figure this out, we've got to simplify. Let's think about this whole system in two really basic parts. You've got the conveyor belt that moves everything along, and you have the gate at the end that decides what gets out. And this analogy works perfectly for our case, right? The constipation, that's like a huge traffic jam. It's a motility problem. The conveyor belt, his colon, is just not moving. Then the incontinence is like a broken gate. It's a control problem. The sphincter just can't stay shut. So the million-dollar question is, what could possibly break both the conveyor and the gate at the same time?
Well, the answer, it turns out, isn't in the machinery itself, not the muscles. It's in the wiring, the complex electrical grid that tells those muscles what to do. To find the root cause, we have to follow the nerves. And here it is. This is our map. Now I know, it looks like a lot of squiggly lines and labels, but don't worry about that. What you're really looking at is the command center, the nerve network for all our lower body functions. And somewhere in this spaghetti of wires is the one single fault that's going to explain everything.
All right, let's tackle problem number 1 first, the traffic jam. Looking at this map, what's responsible for keeping the conveyor belt moving? What actually tells the colon to, do its job?
Okay, this is where it gets really interesting. It turns out the colon actually has two different bosses. There's this dividing line called the splenic flexure. The upper part of the colon gets its orders from the big vagus nerve, but everything below that line, the lower or distal colon, is controlled by a completely different set of nerves. These are the pelvic splenic nerves, and they originate way down in the S2 to S4 region of the spine.
Now think back to our case file for a second. Where was the traffic jam? It was specifically in the distal colon, the lower part. And boom, just like that, we've got a massive clue. This tells us the vagus nerve is probably fine. Our investigation needs to focus squarely on that S2 to S4 nerve region.
Okay, huge lead, one problem down, one to go. Now let's look at problem number 2, the broken gate. What part of this wiring diagram is supposed to be controlling the sphincter? So it turns out there are actually two gates down there. There's an internal one that's basically an automatic door, but then there's the external one, the manual door that we control on purpose. And here's the kicker. That voluntary external sphincter is controlled by something called the pudendal nerve. And can you guess where that nerve comes from? You got it. The exact same S2 to S4 sacral roots we were just talking about. All of a sudden, both of our clues are pointing to the exact same spot on the map. So, we have a prime suspect. But a good detective always rules out the other possibilities first, just to be absolutely sure. Let's do a quick process of elimination. Okay, could it just be the pudendal nerve itself? Now, that would explain the broken gate, the incontinence, but it does nothing to explain the traffic jam in the colon. What about the vagus nerve? Nope, we already established it's in charge of the wrong section of colon. And what if the injury was higher up the spine? Well, that actually does the opposite. It would make the sphincter tighter, not weaker. See? Every other suspect has a solid alibi. And that leaves us with only one possible conclusion. This was never about two separate problems. It was always one single injury, causing two symptoms that just seemed to contradict each other. So let's go back to our map one last time to pinpoint the culprit. Right there. That's it, the single point of failure, a lesion, an injury to the S2 to S4 sacral nerve roots. From this one tiny area, the communication lines to both the conveyor belt and the gate were completely severed.
So here's how that one injury causes the double whammy. First, the go signal to the lower colon gets cut off, so it just stops moving. That's your constipation.
At the exact same time, the hold signal to the external sphincter is also cut, and that's your incontinence. The body's contradiction solved.
So, with all the pieces of the puzzle in place, we can finally make the official diagnosis.
And here it is, the official medical explanation. The patient's symptoms indicate, and I'm quoting here, damage to the sacral nerve roots S2, S4, which provide parasympathetic input to the distal colon and motor supply to the external anal sphincter. It's that unique combination that makes this spot so critical.
So, what's the big takeaway here? This isn't just some weird medical trivia. It's a pattern, a really important one to recognize. If you ever come across this specific combination, severe constipation plus fecal incontinence plus weak sphincter tone, your mind should immediately jump to a possible sacral nerve injury. It's a classic pattern, and by the way, it often involves urinary problems too.
It's pretty incredible when you think about it, isn't it? This whole case shows how one tiny specific injury in our body's incredibly complex wiring can lead to these huge life-altering problems. And it leaves you with a really big question. What other single points of failure like this are hiding in our bodies, quietly running the vital systems we totally take for granted every single day?